Hey, happy holidays and happy New Year. It's been a while since you visited us at It's Your Health, and we'll tell you why a little bit later. But we'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Please check with your healthcare provider before doing any of the things that you hear about here on It's Your Health. We'll be right back. Welcome back to the first segment of It's Your Health. Philip Benyo with Philip Benyo, bringing you the latest and greatest in healthcare information. And get a load of this first headline. Benyo's join AMG. Do you want to explain what this means, Phil?
AMG stands for Alliance Medical Group. It's a group of physicians and practitioners that are locally kind of joining a bigger group of cardiologists, endocrinologists, primary care, geriatricians now. Right. And for the day-to-day operations, it's really not going to change much. We're still here at the office. We're not retiring. We're not moving. We're not doing anything. We'll still have the same faces here in the office, and our cards will have a AMG on the top of it. That's about it.
The only thing that changes may be a sign outside. But yes, look forward. Jim Edwards, the president and CEO of the Greater Hazelton Health Alliance, has put together a terrific train full of high-powered physicians who are eager to treat you. So more to come on that. Now should we get down to brass tacks?
Real business. Let's start off with some headlines.
First headline, yes.
Increased risk of mortality and readmission among patients who are discharged against medical advice.
Well, this is kind of like a no-brainer. If you leave the hospital before we treat you, you of course are going to be either readmitted or have a worsening of your symptoms. It's similar to what, Phil?
It's similar to me telling my mechanic what to do. You know, if we're not quite done, you know, we don't keep people in the hospital for fun. We like to keep them, in fact, out of the hospital as much as we can. So when you're in there for a very good reason, and you're in there for an appropriate amount of time.
Amen.
Alternative smoking cessation, such as acupuncture and
hypnotherapy,
may help you quit smoking.
Well, that's a good New Year's resolution there, Fipster. And it's for smokers out there and people who treat them, it is extremely difficult to stop smoking and stay off cigarettes. So if you're not into medications, you might consider acupuncture and hypnotherapy. They do have some advantages.
I've seen it work.
Yes.
Moving on, low-dose aspirin and cancer mortality. A recent study suggested taking aspirin daily does help decrease your risk of non-vascular death, such as cancer.
I mean, you should be taking either an 81, or what I do is take two 81s, 162 milligrams of enteric-coated aspirin, so it doesn't upset your stomach, lower your cardiovascular risk, stroke risk, and here will lower your chance of developing a cancer.
Well, let's now move on to the meat of the show. And speaking of meat, that's something we ought to eat less of. Let's talk about anti-inflammatories and rethinking the way we eat and eating foods that are higher and richer in antioxidants.
Well, when we were hunters and gatherers, we didn't have processed foods, we didn't have fast foods, we didn't have as much diabetes or obesity. And so we need to get back to that either Mediterranean diet or hunters and gatherers diet. Whole wheat, grains, fruits and veggies. They will translate to a lower chance of having disease across the board. That's pretty much what we're talking about?
Yeah, I think it makes sense. You know, that some of the processed foods that we have certainly are increasing our risk of diabetes, and it increases the inflammatory markers in our bloodstream, and that's something we can measure. You know, and that kind of goes for everything. You know, it's if we can increase our antioxidants, and we'll have a net effect of decreasing our anti-inflammatory problems.
And speaking of which, again, we are not harping on fish oils, but we're going to harp on fish oils because they are the most powerful anti-inflammatory that God has created. So not only do you want to get into more fruits and veggies, you want to accent and supplement your diet with fish oils. The omega-3s will reverse some of the inflammation in our bodies and help to add to a diet. And again, we're just kind of suffering from chronic food poisoning.
Yeah, in many ways. Our American diet certainly is is not a healthy one.
Correct.
Let's talk about other types of anti-inflammatories. And usually when we see, one of the things we see this time of year, it's getting late, people are slipping, there's ice, we're getting a lot of knee injuries, knee pain, and even for some of our chronic arthritis sufferers, the colder weather kind of stiffens them up. We have our usual kind of ways to treat that, but we're reading recently something different.
Right. Well, when you have osteoarthritis of the large joints, the weight-bearing joints of the knees, there's a little we can do. You can try anti-inflammatories. They're a little dangerous because they have side effects. You can try joint injections, which can be useful in some patients, either a cortisone shot or a Hyalgan shot. But we are seeing more and more patients actually going for knee replacements at much younger ages. And this particular study we talked about showed that some low-dose prednisone, and that sounds almost like heresy.
It's against everything we talked about up until this point.
Right, some low-dose prednisone in a select patient can actually be the most effective way of decreasing the amount of pain and suffering from osteoarthritis. It might forestall putting a new knee in, and we'd have to select the patient because the side effects of prednisone could be worse than the disease that we're treating. But there is some evidence that given a selected patient some low-dose prednisone, you'll be dancing with the stars.
We see that even circumstantial. When we put people on prednisone, I rarely put them on it just because their knees hurt, but I'll put them on it because maybe their thyroid's overactive, maybe they have an allergic reaction, but they'll always come in saying, boy, my joints and knees feel a lot better on this, and then it all comes back when we stop it. So there certainly is some circumstantial evidence that it would work, but we have to really be picky and choosy.
Yes.
Moving along, angiotensin II receptor blockers in combination therapy, versus kind of sticking with one blood pressure medication. A lot of the new guidelines for blood pressure are telling us that we need to use more medications, not more of one medication, that the combination therapy really is the way to go.
No doubt, Phil. And one of the frustrating things in practicing is seeing undiagnosed and uncontrolled or poorly controlled hypertension or high blood pressure. It's a silent disease. It's like putting too much air in your car tire. It's going to lead to excessive wear and tear and a blowout of some blood vessels. So we're finding that rather than take one pill and push it to higher doses, combination therapy is where it's at. And I would say maybe 80% or more of our patients who are controlled with 2 or more agents in lower doses, kind of like making a salad. You have a little bit of this, a little bit of that.
Yeah, half of the people require 3 or more agents.
Right.
That's a big number when we think about it. Let's talk about a new drug.
Okay, talk to us.
Xarelto. We've actually talked about this before. Xarelto is one of the Coumadin replacement medications.
Right.
Similar to Pradaxa. What differs in Xarelto from Pradaxa is it's a once-a-day dosing, and it has some new indications. It's not just used to treat atrial fibrillation or irregular heartbeat that can cause a clot, but it now has been it's been indicated for prevention of DVT and prevention of PE, or
right.
pulmonary embolus, or a blood clot in the leg, or a blood clot in the lung. This is very exciting because it really has helped expanding the different patient types, and it's lowering our use of Coumadin, which we'll talk about later on as one of those medications that you have to be very careful about.
Right. Look forward to using it, and of course it gets a bad rep because it's sort of a cousin of Pradaxa, which, by the way, as this headline shows, the FDA has come out and said Pradaxa has really not been implicated in all these bleeding episodes that you see in daytime television ads.
Lawyer ads, yeah.
Exactly. Well, listen, I told you it's the fastest half hour in television.
Getting back to that lawyer thing, that's like me telling my mechanic what to do, right?
Exactly.
Patients watch using lawyer ads to decide what medications they should take.
Big problem. And again, we're finishing off the first segment of the fastest half hour in television history. We'll be right back with It's Your Health. Remember, we're your leaders in healthcare information. Welcome back to the second segment of It's Your Health. Philip Benyo with the Fipster here, plowing through medical knowledge as if it were a light onion snow.
So, moving along in the headlines. Fish consumption and colorectal cancer risk. Recent studies, in fact, many recent studies have shown an inverse relationship between fish consumption and colorectal cancer risk.
Can you explain that?
What that means is the more fish you eat, the less chance you have getting colon cancer.
There you go. I like that. Problem is, of course, who's eating fish, who's cooking these days. Heavy metals in the fish are an issue, which brings us back to fish oils. I'm sorry to say, you want to have anti-inflammatory, lowering disease states without the omega-3s. Hey, by all means, you know, eat your sardines and have your fish, but you might want to consider doing the same thing with a branded fish oil. Now, isn't there a difference between the fish oils, Phil? Wasn't there a study done recently that these particular fish oils get more absorbed into the bloodstream and get incorporated more?
If you've gone that far, I guess you could take us the rest of the way.
No, I kind of forgot.
Well, yes, the fish oil companies recently did a study that looked at fish oil absorption in the red blood cells. And if you read the cardiovascular literature, it's important to see about an 8% absorption rate. Okay, so 8% of that fish oil can get into the red blood cells. And the PRN brand, or Physicians Recommended Nutraceuticals, is the only company that was actually able to show that it got to that 8%, which means you're actually getting a cardiovascular benefit from your fish oil. The other companies that make fish oil in a similar way weren't able to even show that absorption rate. So that's a big deal. You know, that shows some real, you know, the biochemical proof that this is working.
And it's something you've heard before, because what this company throws away, they give to the chains and Walmart, not to pick on Walmart, but all the other chains where you get cheap fish oils. You're getting what this company throws away. It's not getting in your system. It's not doing the job. It's not going to work. You're not going to be happy.
Moving along.
Second headline.
Rheumatoid arthritis recently had a new drug added to the armamentarium called Xeljanz.
I'm not familiar with that at all, Phil. Maybe you can.
Well, we don't really treat rheumatoid arthritis, but our goal is when we see it or diagnose it, and when we refer, we can kind of help patients talk about it. And this is actually an exciting medication for rheumatoid arthritis, because most of the rheumatoid arthritis medications we talk about here are injections, either once a week, once a month, once every day. This is a pill, you know, and really the only pill out there that really is approved for rheumatoid arthritis other than this is methotrexate. And this is designed for the people who don't respond to that.
Terrific. Well, there you go.
Lastly, a gun with a new medication. We've talked about this before, Qsymia. Qsymia is a new weight loss medication, which is in some pharmacies. It's something we really haven't had a chance to be educated about properly. We have patients asking us about some new medications. There is another medication for weight loss out there that has been approved. You know, obesity is the American epidemic, and you know, with that comes cardiovascular risk, diabetes. You know, it's bad knees, everything. And so it's important that we have some better things to help defend against that.
And how do you see this as fitting in? I mean, you look forward to using this?
I do look forward to having it as an option, you know, because even a lot of the studies out there will show the placebo arm of people who are on weight loss medication, they help lose weight. So what it will be is for us is talking more about weight loss, talking more about diet and exercise and healthy living, which we've delineated previously, but this will be something that will help us get that extra edge.
It's what America wants, a pill to do something rather than diet and weight loss.
Speaking about pills.
Oh, yes, indeed.
Let's talk about some pills that really we need to be careful about.
Well, there are 4 drugs in general that make us gray and lose our minds, and can create tremendous side effects. And they just come in 2 categories. The first category, of course, are the blood thinners, the Coumadins, the Pradaxes, the Agrinoxes, the Plavixes. All of these medicines have bleeding as a side effect, and they have to be monitored very closely. The other major issue is that of diabetic control, either insulin or pills. The last thing we want is a low blood sugar, although most of us don't really suffer from that. We're seeing high blood sugars, especially after the holiday season. Do you want to elaborate a little bit more on these 2 classes?
Well, I think it's very, I mean, things like Coumadin, you know, Coumadin's an older medication we use for people who have atrial fibrillation, again, to prevent clots, people who have blood clots in their lungs or their leg. And, you know, it has a therapeutic window, and if you're not into that window, the medication may not work for you. And then the beauty of a medication that's not in the window and working for you is you still get all the lovely risk associated with it. And so some of the newer medications obviate that a little bit, but still, these are potentially dangerous medications. You know, not a great thing to be in a car accident with or have a fall.
Exactly.
The anti-diabetic medications, certainly high blood sugar is not going to kill you quick. That takes decades, but a low blood sugar can do you in pretty fast. You can do that while you're driving and have an accident. You can be on a ladder. they can be dangerous. And I kind of will tell patients rather off the cuff, I said, if you're not having any low blood sugars, you're not under good control. We need to get those sugars down with the risk of getting low. And the new diabetic guidelines really want us to get those numbers as low as possible to non-diabetic levels, which makes sense, but that can sometimes be difficult.
Yeah, it is. You're really on a balancing beam. And that leads us into the whole idea of polypharmacy, too many drugs to begin with. As our population gets older and has more medical problems and seeing specialists who are all throwing in their potion to the pot, we get into what's called polypharmacy. You can maybe tell us a little bit more about that, Phil, but after a while we start treating side effects of drugs with more drugs, which is exactly the opposite of what we want to do.
We see this all the time when we take on new patients, especially in the geriatric population, in the nursing homes, in the personal care homes. They'll have a list of medications that is just legendary, and you can see how things get added on by different specialists who really aren't doing a great job of probably talking or knowing what's happening. And you can see people on things that are really contraindicated. People who are on things like ibuprofen and they're taking Coumadin. That's a blood thinner with an anti-inflammatory. That's a recipe for disaster. And so it's really important that you review not only your medications, every time you go in for a regular checkup, but if you have a loved one and you want to go over the medications, bring it up. Bring up, is this too many medications? Are there side effects that are being treated by other side effects? And just to see that everything's playing nice. It's hard to imagine that when you're taking 10 pills that you're not going to have a problem.
Exactly. And we brown bag it. We tell our patients to put everything in a brown bag and bring it down, and generally we can get rid of one or two drugs that none of us really knew that she was taking or they were on it, and that includes supplements as well.
Oh yeah, that could be quite dangerous as well. There's a lot of different supplements out there, and there's this perception that if I can buy it over the counter it's safe, and if I have to get it as a prescription it's not safe, and sometimes that can be quite the opposite. Moving along.
Tell me.
Let's talk more about inflammatory disease in general. And I thought there was a very interesting study that we read about IBS, or inflammatory bowel syndrome, or inflammatory bowel disease such as Crohn's colitis and ulcerative colitis. These actually have an increased risk of coronary artery disease or heart attacks.
Not surprising. We feel as though what causes hardening of the arteries are inflamed arteries. So if you have inflamed intestines, it's not much of a stretch to see that you'd have inflamed arteries. Again, think fish oils, because that will bring down your risk of badness. And speaking of risk of badness, here we are going into another commercial break. Again, it's the fastest 30 minutes in television history. It's watching It's Your Health. We'll be back after this brief commercial message. We are your leader in healthcare information. Welcome back to the third and final segment of It's Your Health. We're really moving right along here, Phil. If we can get through this segment on time.
Keep on plowing. All right, the Association of Tooth Scaling and Decreased Cardiovascular Disease. A recent nationwide study done here showed that getting your teeth cleaned does help decrease your risk of cardiovascular disease.
And the mouth is something that we generally ignore. In the hospital, we don't have dentists or orthodontists come in. Poor dental care, without question, leads to a whole host of diseases: malnutrition, infections, debility, weight loss. And so oral care is extremely important, and you really need to make a New Year's resolution to upgrading and upscaling your dental care.
Herbal remedies may be an option for certain type of ankle sprains. Tromial ointment, when compared to diclofenac, which is Voltaren gel, had equal efficacy in helping decrease the inflammation in joints that are either sprained or strained.
I think we're going to have to ask Sammy to put up that name of that particular medication on the full
so you
screen.
can run out and go get it, and find out where you can even find it.
But it will help your ankle sprain.
Right, it does help reduce that inflammation, and certainly anytime we can use a topical agent versus something you have to put in your mouth, I think that's a good idea. Moving on. Medical food supplements for the treatment of dementia. This is something we've touched on probably a couple of years ago, and it's fallen by the wayside, but we're going to touch on it again.
Well, nothing is more frustrating than to watch a loved one kind of go into the throes of dementia. It's difficult, obviously, to reverse, since there is nothing we can do to reverse it. We can slow it down. We have what are called parachute drugs they slow down the disease. You're still going to fall, but you're not going to fall as fast and as hard. And it's just very frustrating because some of these dementias, particularly if they're vascular in nature, can progress stepwise very, very quickly. But you're saying that there's a supplement that might be able to help.
Right, there was a supplement they tested. There's been a couple of them out, but the most recent one they're talking about is one called Sovanade, which you can see on the screen. And it actually showed that it had equal efficacy to some of the medications that we use in helping slow the progression, which is, I think, a very interesting note. A lot of these medications usually have problems with decreasing your appetite, which is kind of the, that's the harbinger of bad news in dementia patients when they stop eating. And so having something that would be a food that we could eat as opposed to a pill that we could take to slow that dementia. And there's no comments on here as to maybe a potential synergistic effect using it with the medication, but it's certainly an interesting study.
Absolutely. Speaking of studies, we were over in Ireland, and speaking of Ireland, that of course we can't say what a great fall it's been. Every weekend we have a Notre Dame win, right? And we have a Penn State loss. I mean, what it's like dying and going to heaven.
So he brings back a news article, and I don't know why he's so concerned about Jerry dating Mr. Wrong.
No.
Oh, is that what you were concerned about? Oh.
Let's hold it up there. This is from a British tabloid, and give statins to all over 50s. You see what they're thinking over in the other countries? They see the benefits of lowering cholesterol. Statins, by the way, are anti-inflammatory medications. So they're saying, whether you have a disease or not, if you're over 50, you should be taking it. This is the British thinking.
Period. End of statement.
Yes.
And that's pretty wild. And I kind of agree with that. These medications are used in so many different applications, and they just decrease cardiovascular risk. And you know what? You don't hear many people not dying of some type of stroke or heart attack or complication of that. So if we can decrease that risk, we're going to live longer.
Right. And of course, every time we try to sell a statin, if you will, to a patient, they talk about the side effects. They don't want to take it. They get muscle cramps and pains. They're concerned it will make diabetics worse. In point of fact, diabetics actually should be on a statin, don't you think, Phil?
Absolutely. And even if their cholesterol is good, it shows that being on a statin, independent of your cholesterol numbers, it decreases your stroke and heart attack risk. And that kind of weighs into the fact that these drugs are doing more than just lowering your cholesterol.
Exactly.
Because if we lowered your cholesterol in a more natural way, we don't necessarily get some of that lowering of the stroke and heart attack risk, especially in a diabetic.
That's a very interesting study that you reference, is that sometimes just weight loss, although we'd like diet and weight loss, it generally doesn't happen. But just lowering your cholesterol will not necessarily lower your stroke or heart attack risk. These statins have other anti-inflammatory properties, some more than others, which we'll try to get into a little bit later this segment.
Moving along, and I think that this is a study we talk about how, Britain might be doing a better job of us lowering our cholesterol, but when we compare the cholesterol of the average adult, say, of 10 or 15 years ago, it shows that we are doing a better job, and we are lowering the cholesterols in general of U.S. adults, and so we're doing a better job of using medications properly, and I think we spend a lot of time doing that.
And if you want to have a good statin, which one would you consider there, Fipster?
Well, I think there's two statins that are out there that are really above par. I think Lipitor is an excellent statin, and also Crestor. Crestor is one of the more interesting statins. It's one of the only statins that can show and prove that it can decrease the risk of it can decrease the size of a plaque. It actually can shrink it down. And there's no other statin out there that does that. Most statins can stop the plaque from getting bigger. This one actually has been able to prove that they can shrink it down, and that's a really neat bonus. And I think if cost wasn't an option, I probably would be using Crestor.
Crestor it is. So that's one of our headlines here that we're talking about. And what else? I guess we've exhausted all the topics on the planet, right?
Well, recently there was actually some interesting news talking about autism and Asperger's syndrome. And Asperger's syndrome was considered an offshoot or a completely different condition in autism. And now, recently, they've kind of put that in the same group as autism, and it's just a different type of autism. And this is something that in primary care and in the adult population we don't see very often, but there's increasing numbers out there, and more we're hearing about autism, and more the risks are, or at least the numbers are going up. And what would you like to comment on that?
what happens to the autistic kid who grows up?
They eventually will come see us.
Okay, so Asperger's syndrome, can you tell us a little bit about what features of the syndrome would be apparent?
Asperger's syndrome, without offending someone who has a child with Asperger's syndrome, very plainly, they have a little bit more of an aversion to human contact. They usually don't make a good eye contact. They make what would seem to us inappropriate comments, but they're appropriate within that realm, and that's some of the real basic key features. And so sometimes they'll say, well, you know, he's just a kid or this, that, but it's so much more, and it ends up affecting at least the development of that child. It affects the ability for that child to function normally in school without any assistance. And part of lumping Asperger's in with autism actually will help patients who have Asperger's, because there's a lot more funding out there. There's a lot more help, you know, at our school district level, at our county level, and state and federal level. So it actually is a helpful thing to kind of bring that into that category.
Well, good advice for those who are listening, and you are listening to It's Your Health. Thank you so much for allowing us to come into your home to inform and hopefully entertain you. With the Fipster, we're saying goodbye, good luck, Happy New Year, and try to keep your New Year's resolutions. Remember, you're watching It's Your Health. We're your leader in healthcare information.